We move now to rising concerns about monkeypox in America. It has now been declared a public health emergency by the Biden administration. That move comes on almost 2 weeks after the World Health Organization did the same. And in the last week, 3 states have issued their own emergency declarations. With more than 6,600 cases, the U.S. is facing the largest outbreak in the world. The total cases have doubled about every 8 days since May. So that brings us to Dr. Ashish Jha. He joins us now. He's the White House COVID response coordinator, also helping in this fight. And Dr. Jha, good morning. You know, when people hear public health emergency and then they also see it's 6,600 cases, they're probably going to be alarmed and wonder, what does this mean? Why is it a public health emergency? Can you explain?
Yeah, absolutely. Good morning, Savannah, and thanks for having me back. A public health emergency declared by the Secretary of Health and Human Services unlocks a set of tools, allows us to speed up vaccines and make treatments more easily available, allows us to gather data more efficiently. So really, this is about the government taking this very seriously, about putting more tools into our toolbox as we fight this virus. But as you said, 6,600 cases, we're going to see that increase as we ramp up testing and make testing even more widely available. But thankfully, no one has died of that in the United States, and we're going to do everything we can to both get the cases under control and obviously make sure that people don't end up getting particularly sick.
You mentioned unlocking the toolbox. The WHO unlocked this toolbox by calling it a public health emergency a couple weeks ago. States have done so. Is the White House once again kind of playing catch up here?
No, look, we have a different perspective than a state or the World Health Organization. WHO obviously looking at the situation across the whole world where this is out of control in many countries. Obviously, there are specific states where the cases are more concentrated. We're looking at across the country, and we're looking at across the nation, when is the appropriate time to make that declaration. The Secretary of Health and Human Services yesterday decided that it was time, given where we were, given how much progress we've made, and what other progress we need to make, that was the appropriate moment to declare it a public health emergency.
Now, the CDC director yesterday said in a briefing that the highest risk population in the U.S. amounts to about 1.6 million people. As I understand it, we only right now have enough vaccine for about a third of those people. So how concerned are you about vaccine supply?
Yeah, so we have enough doses, first doses for about 2/3 of those people, and then we're working on getting additional. I remind people there is one small company in Denmark that makes all the vaccines for the whole world. And we have secured more doses than the rest of the world combined. But we've got to do more. So we're looking at, and we're actually not just looking at, we're working on expanding it to American manufacturers who can make those vaccines. We are going to quickly ramp up vaccine manufacturing here in the U.S. and elsewhere to make sure that there is global supply and certainly make sure that there's enough supply for all Americans who need it. And right now, the group that needs it is a very specific population, gay and bisexual men, and we want to make sure that we get vaccines out to that community.
Yeah, I was going to mention that the federal health authorities are saying that this is primarily affecting this population of men who have sex with other men. How concerned are you that it could spread into the wider population? And what is your message to that community this morning?
Yeah, so my message to the community of gay and bisexual men is, look, we obviously take this very seriously. Part of the reason the administration has declared a public health emergency, and we're going to continue working very closely with that community, not just to get vaccines out, but make sure testing is easily available, making sure that people are getting treated when they get it. For the broader community, what I would say is, obviously we're going to continue monitoring. About 98% of cases, so pretty much every case, most cases are in that community. So I think for the rest of America, I say, well, let's keep watching. Let's see if this virus spreads much beyond that community. But right now, my hope is, as we continue doing what we're doing, that we're going to be able to really contain it.
All right, Dr. Jha, thank you very much. Appreciate your time.
Thank you, Savannah.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.